How are new medicines developed?
So one of the questions that people have asked is, why are people being observed after their vaccination? We don't do that for all vaccinations or all treatments. And I just want to give you some background to this, because this is something that is not unique to COVID vaccines. When we develop a drug or a medication to treat a disease or a vaccination to prevent a disease, it goes through a development process. Phase 1 are small studies, phase 2 are larger studies that both look at the safety, and then phase 3 is a much larger study to show that the treatment or the prevention method, such as a vaccination, works. Once the medication or the vaccine is shown to be effective and safe in those trials, the phase 1, 2 and 3 trials, it can be registered by the regulatory authorities, which is South Africa is SAPRA, or in America is the FDA. But even after registration, so once it's been through those 3 phases of trial, after registration, there's a period of time with all medication and with all vaccines called the post-marketing surveillance period of time, or some people refer to it as phase 4, where we just take an extra level of care to make sure there are no side effects occurring that were not picked up in the phase 1 to 3 trials in a much broader group of people. And it's really just to apply an extra degree of caution with new medication. As I say, this is not something novel to COVID-19 vaccines. This is something that we do with all medication when it's first used. And it doesn't mean that there is a problem. It just means that if a problem occurs, we can pick it up, refer it to the regulatory authorities, and that doctors across the world will know about that. So the fact that we're being cautious during the early period of using a drug more widely or a vaccine more widely doesn't mean that there will be a problem. It merely means that we're looking closely in case there is another problem that was not initially picked up in the trials phase.
Proudly produced by the University of Cape Town, Project TeamCare and Groote Hospital.